Our objectives, we need to talk about rules and regs, and I know you don't want to. You joined home health for a primary purpose of getting out and seeing patients. Having conducted orientation many times and sat through my share of orientations, it's really difficult to get it done. You want to get out of this, you want to go see patients. That's the only reason you became a therapist anyway, not to have to sit down and discuss all this other stuff. But one of my goals with this training series is to correct a problem I encountered on my orientation to home health. I will never forget the day when I walked into the agency, my very first day in home health, and they handed me an evaluation form and a patient address and told me to make the visit and find my way back to the agency. That was my orientation. And I remember sitting in the driveway, looking at the house, thinking, what on earth did I get myself into? I know how to do PT, but all this other home health stuff was very foreign to me. And what I found was my orientation more often than not was trial and error. Someone would say, well, you're supposed to do this. And someone else would say, no, you're supposed to do that. And I remember feeling very inept, not about the therapy stuff, but about what exactly am I supposed to be doing in home health. And so we want to rectify that. That's not saying that this is the all-knowing video series, but we want to give you a solid foundation on some of those core issues. Because once you get that under your belt, delivering patient care is where you get to put your priority back to. But we do have specific challenges, particularly around homebound status. You could ask the seasoned people at your organization to explain homebound status, and you may get slightly different explanations there as well. So we want to make sure we clearly understand what that means and what it doesn't mean. And where do all these rules and regs come from? We have to understand there's multiple layers. There's federal rules, there's state rules, there's local rules, there's agency rules. Yes, that sounds like a lot of rules, but a lot of them have themes, and we want to make sure we understand what those themes are. And we want to welcome you to home health. It's an exciting area of practice. It is one of the few settings left where the therapist actually gets to work with one patient at a time. I mean, I look at the other settings where you're running around from room to room or having multiple patients at the same time, and I remember my days in acute care where patients didn't have names, they had problems. That guy was the knee, that guy was the hip, that lady, her arm's in a sling. I don't know what her name is. And when I would go up to their room to say, this is what we have to work on, they'd be in a test. And then you'd come back later and they'd be in another test. And then you'd come back later and they had been discharged. Home health is very different from that. We get to spend one-on-one patient time, running anywhere from about 45 minutes to an hour with one patient. You get to stretch your educational skills. You get to really look at the functionality of being in the home, which can be unique, because the hospital and other settings eliminate a lot of those obstacles. There's no shag rug in the nursing home. There isn't oxygen tubing weaving around assorted pieces of furniture. And there is no dog that is so excited that this patient has returned home that it just can't be parted from her for even a moment. But those are the aspects that make home health exciting.